So here we are today at Customized Relief. I'm here with my nurse practitioner, Dr. Curtis Beal. Really excited about some new things that we have in the practice, one of which is cancer screening. And so I know we're talking to a company now, or using a company called RGCC, and they're out of Greece, I think, originally. What can you tell us about the company and what they have for us?
So RGCC is the lab / company, and they are very focused and on the forefront of cancer, as well as some other viral, tick-borne type things as well, but very advanced on screening tests and even some treatment options maybe we'll get into. But they are out of Greece, as Dr. Roberts mentioned, and they have a number of different tests that not only can screen for cancer, but if you already have cancer, they have some cool things that can help us to treat that cancer more precisely.
Well, let me go there. So again, there's a lot of push now to try to find a better way to screen for cancers that we just don't have good screening tests for. And I know there's some other ones that are out there. Tell me a little bit about OncoDeclare, because I think that's what this company uses for their screening test.
So OncoDeclare is what we term a liquid biopsy, which are becoming more popular these days. It's a lab draw, and what it's looking for is any traces of cancer. And so it's a very good screening tool for somebody that is just routinely, wanting to make sure that, do I have cancer? And I think we're finding more and more, if we can catch cancer in that stage 1, especially, even stage 2, the chances of you beating that cancer goes up astronomically. I think most of the studies would show if you can catch it in stage 1, most cancers you can treat and actually cure up to 90%. So it's a big deal to be able to find out cancer. I know I'm one of these people. There's people that are like, out of sight, out of mind, I don't want to know. But it really is imperative that we find cancers early, because we know we can treat those and actually cure them at that stage.
So that's good. And again, if let's say one came back as positive, or let's go a step further, what if we have a patient who comes in who says, hey, my doctor told me that I have a lesion on my lung, or I found something in my liver. Again, we're not telling people to go away from the standard assessments or even treatments. We're trying to augment kind of what they have for information, because information is power when it comes to helping with cancer, again, because it can be deadly. So if we look at in the same RGCC company, let's say we had a lesion like that, or we had a positive declare, tell us a little bit about OncoTrace and Onconomics Plus.
Okay, yeah, good question. We'll start with OncoTrace because Onconomics Plus feeds off of that. So let's say somebody has a suspicious lesion, or let's go a step further and say that they have confirmed cancer, a solid tumor, let's say prostate, breast, lung, anything of the sort. Well, we can do a test called OncoTrace, which is basically like a roadmap for that cancer. So what it will do is, it is looking, RGCC specifically, is looking for what are called circulating tumor cells, CTCs. And they're looking for how many of those CTCs are circulating in the body. And that's kind of your marker as you treat the cancer and as you follow that cancer, to tell us how well your treatment is going. And so you can do an OncoTrace, and it will tell you the amount of circulating tumor cells. And then that will then trigger, if you want to take it a step further, to do something like Onconomics Plus. And this is really, really cool. Again, we're by no means saying everything needs to be natural. We think there's a place for the conventional route, and so does RGCC, because this Onconomics Plus actually checks for not only herbs and supplements, but also the chemotherapy agents. And what it does is it matches your specific cancer to the specific drug or herb that will work most effectively for that cancer. And so it's really, really neat. They basically test it against your cancer with that specific supplement or chemotherapy agent, and it will give you a score based on how effective that will be at treating the cancer. And so what's really neat about it is the Onconomics Plus, you really only need to do one time, but you can do that OncoTrace we talked about every 4 months and monitor. And we've seen it firsthand, and I've done a lot of training with this lab, and you can see these CTC cells just plummet as you're treating it with the right thing. Because a lot of times we read about different supplements that work for cancer. We have friends and family that have done something that worked for them, but your specific cancer is specific for you, and you can find that specific supplement, chemotherapy agent that is going to for sure target that cancer. And so it takes the guessing out of it. It's really, really neat.
Well, and again, as we said, this is not to replace necessarily, but it does. The idea is we're personalizing management. And so even, and again, our colleagues in traditional oncology may not follow this pattern, but even if they don't, even if they say, no, this is the chemotherapeutic direction we want to go, we have at least some more ammunition with even some of these other, whether they're herbal supplements or frankly some other prescriptives that we could add in that will specifically target that patient's cancer. And again, the beauty is, as you said, we now have OncoTrace to see, are we being effective enough with the treatment, which is really neat.
Exactly. And so, yes, we're really, really excited. I will talk about one last thing before we wrap up, and it's called a Q restraint. And this is another, this is actually a treatment modality from RGCC labs. And the way it was described to me, and I think it's a really good analogy, is basically these Q restraints act like if you were to go to a bar and you were with your friend and you got into a fight. The Q restraint is kind of like your friend in that if it goes and grabs the person you're getting ready to get into a fight with and immobilizes them, well, you're going to have a lot better chance of beating that person in the fight because they can't move. That's kind of what these Q restraints do, not only with cancers, but Lyme disease, chronic viral illnesses. So there's all these different things that RGCC provides. I think Q restraint is another cutting edge option. And again, all of these things can be added onto conventional treatments, chemotherapies, any type of supplements, any medications you're taking. And so again, we're just trying to give you extra tools in your toolkit to take down cancer, which again, unfortunately, we're seeing is running rampant in our country and the world today. So
it really is. And again, so here at Customized Relief, we just want to offer people things that are out there and available. Again, this is yes out of Greece, but there are people in the United States that are using this therapy, and it just gives more information. It's much more personalized. We want to do anything we can to try to help patients, and I think this is such a good tool.
Yeah, we're really excited. So thanks for listening.
Thank you.